Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here today on Health Professional Radio for this Health Suppliers segment. You know, many hospitals recognize the business efficiencies of managing files electronically, but they still find themselves rather dependent on paper-based systems to handle some of those clinical record projects. Our guest in studio today is Mr. Sean Morris, Director of Sales for Digitech Systems. And he's here today to discuss with us how some of this technology can improve hospitals' efficiencies, especially when it comes to managing medical records. Welcome to the program, Sean.
Hey, good morning. Thank you for having me, Neal.
Thanks for coming. Now, as Director of Sales for Digitech Systems, give us a little bit of your background and how you came to be involved with Digitech.
Sure. Actually, I've been with Digitech going on 14 years now. But I've been in the enterprise content management space, or ECM space, for about 20 years, working with different technology. And essentially, many moons ago, I used to work with a practice management organization that specialized, in that case, in chiropractic healthcare. But it branched from there into a number of different specialties in medicine. And so one of the things that, I saw early on was a need in the healthcare space to help organizations become more efficient. So it's everything from hospitals to small physicians' practices. They all have the same problem, and it's a multitude of problems. It's not just dealing with the paper from a processing standpoint or a back office administrative standpoint. It's how do I provide the best total patient care that I can. And so after I worked with that group for a while, I found an organization called Digitech Systems, and I loved what they did. I loved the simplicity of their products. I loved the fact that they made it affordable and easy to use for organizations of all sizes. And I was asked to come on board and help them with growing the channel, specifically in the direction of some of our healthcare clients, which happens to be one of our largest verticals.
So exactly how does Digitech Systems improve the efficiencies, as you say, of these organizations?
Great question, and I'll give you an example. The number one thing that people buy our technology for, and we sell a lot of software to the healthcare organizations out there, but the number one reason that they buy our software is because they're simply running out of space. So, for example, we have an organization here in Colorado, Family Health West, that was a hospital chain, and they had just filing cabinets full of patient charts and information. And they were getting ready to open a new hospital, and so they were faced with the dilemma of where are we going to put all of this paper. And so they figured out if they could scan it using our paper flow technology, they could create an electronic image and start to eliminate the need for those file cabinets. But there was another benefit that they saw out of that. They were able to search for patient information and patient records and get it instantly instead of having a person go and rifle through, filing cabinets of charts. They found that they were able to maintain the security and control of the file, which, as you know today, is very important. But the overall being prepared and managing the paper in their office problem that they had going to an electronic digital format made it much more efficient for them and eliminated a lot of the need for the electronic filing cabinets.
You're talking about being strapped by this paper monster when it comes to these medical records. Is there ever a scenario where you can completely eliminate the use of paper as far as, getting patient information and transmitting information to the patient, via your screen? Are we talking all about, just scanned images, or is there documents in there that are created within the software that relates to these patients?
So that's a great question, Neal. I mean, I think in a perfect world, if we all had a magic wand that we could wave, we'd like to say, I'd like to be able to not have to deal with paper anymore. And that's just not the reality. For years, people have said, I want to completely paperless, and I don't ever really see that happening. At some point, you're still going to generate paper. There's still information that's going to be printed, but with the adoption of the electronic health record, where you have software applications where you're creating patient information and records that relate to that patient in an electronic format, that's one step closer to it. What we have found, and the problem that we see, is that there's still a tremendous amount of information about individual patients that was generated in a paper format. And how do you tie the two together, right? As a physician, you want to solve the problem for the patient. You want to provide the best care that you can in the total care package, if you will. And a lot of physicians are being rated today on how well or how good of care they actually can provide. So there needs to be a gap bridge, if you will, between the patient record and what's being generated in the EHR. I think if you look at something as simple as referrals, right? If I get referred from my primary physician to go see a cardiovascular doctor, they're going to send my record over. Well, that record is not generally in a digital format. It's still, believe it or not, in a paper copy format. And now that cardiovascular doctor has to review the information that's on paper, as well as collect electronic information in an effort to try and give me the best care. A good example of one of our customers is the Denver Mental Health Center here in Colorado. They were early adopters for an EHR application, but they found themselves having to go back many years into the actual paper record of the patient to try and figure out if the specific problem that patients were dealing with was stemming from something, in the past, or if it's something that was recent. So in order to provide the best care, they actually used our PaperVision Enterprise product and just wrote a quick integration with the EHR. So now when they're looking at a patient's electronic health record, they simply click a button and they can pull back all of the images, whether it's a scanned TIFF image or it's a PDF file, anything associated that was once paper, which is now electronic. They can retrieve that information, which gives them the ability to provide better care.
In transitioning your clients' records from paper to digital scanning and whatnot, how do you maintain compliance with HIPAA through all of this process?
Good question. So there are a number of things. One, your scanning application has to be able to provide the use of some encryption technology to protect the electronic image. So once you scan the paper, you want to make sure that whatever scanning application that you're using, in our case it's PaperFlow and our PaperVision Capture product line, you're able to say, okay, I want this information encrypted when it's either stored to a hard drive or released to a back-end document management system. But you also want to make sure that once it's actually in an electronic format, and it's in the document management system, such as our hosted platform, Image Silo, or our PaperVision Enterprise document management platform, that you have things that protect that data. So it's protecting it while it's in transmission, and then it's protecting it while it's actually at rest, sitting there in storage, so that if somebody were to walk away with a PC, as an example, which we hope doesn't happen, but
it does sometimes.
It could. It could, and you need to make sure that information is encrypted in such a way such that they can't actually get to it. Now, we take it many layers further. One of the things that we needed to try and help our customers with was the ability to try and prevent a breach of information, if you will. And so not only are we tracking every single thing that happens in our document management platform with a patient record. We're tracking the source IP address of the user looking at it. We're checking to see who has the ability to print, who doesn't have the ability to print. There's so many aspects of audit controls that we have in place to track what users do with that patient record. But also, if a primary care physician, if my doctor said, I'm going to refer you out, the only way that they would be able to send my record is to a physician is if they actually had that physician on an approved physicians list, meaning they've had a chain of trust agreement in place. So we can actually prevent them from, or anybody in the organization, from printing or sending information out that they shouldn't send out.
So your security measures are extremely multi-tiered. Where can we go online and get more information about Digitech Systems?
Absolutely. You can learn more about us at www.digitechsystems.com. We've got some great case studies with how we've helped customers in the healthcare space, and we'd love the opportunity to talk with your audience and see how we can help them. And
can we get a phone number, a direct line?
Sure. It's 866-374-3569.
Thanks. Appreciate your time today, Sean.
Thank you.
You've been listening to Health Professional Radio, this health supplier segment, with Sean Morris, Director of Sales for Digitech Systems. And he's been talking about how Digitech improves the efficiency of organizations, both large and small, when it comes to EHR. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.